Hey everybody, welcome back. This is Nurse Eunice, and in this video, we're going to be showing you how to weigh a patient. And so whenever you think about weighing a patient, although this may not be on your state's examination, you still have to know how to perform the skill because some of your patients require daily weights. And that'll usually be a patient who is maybe malnourished, they're not eating enough. It could be somebody who has congestive heart failure, where they're at risk of retaining fluids. It could be somebody who's on dialysis, well, because their kidneys aren't working, they're not excreting the excess fluids, they could retain the fluids, and that too could back up into the heart and the lungs. So whenever your nurse asks you to perform a daily weight, at least now you will know why you're doing it. Another thing I want to discuss before we start the skill is to make sure that you do your weights first thing in the morning before your patient has eaten, and also make sure they use the bathroom. If you have a balance beam scale, you'll have to go ahead and zero it. We have an electronic scale, and that's what we're going to be using today during our demonstration. And we're going to get started now. With every skill, you're going to knock on the door before entering the room, and then you're going to greet the resident. Hello, Mr. Mitchell. My name is Eunice. I'm your CNA today, and I'm here to weigh you. Is that okay?
Yes, ma'am.
All right, before I begin, let me go wash my hands. I'll be right back. Don't forget to wash your hands. For the CNA exam, you'll be washing your hands before and after the skill, and also provide privacy. So what have I done so far? I've knocked, I've introduced myself, I've greeted the resident, I've explained the procedure, I've gotten their permission, and then I've washed my hands, and I've also provided privacy by closing the curtain. And now let's get our patient up. Let's get them sitting upright. Right. And so, are you able to sit up? Can I assist you?
Yes.
Right. All right, now let's bring your legs over, okay? All right, and before we stand you up, let's get you to scoot just a little bit. I want to make sure your feet are flat on the floor. And before we get you up, how do you feel?
Fine.
All right, no dizziness?
No, ma'am.
All right, and even though I didn't say it before, Mr. Mitchell has non-skid socks on. And so if your resident or your patient did not have the non-skid socks, you would then put their shoes on. But this is going to be best for the weighing scale because it doesn't add as much weight. All right, so on the count of three, we're going to stand, okay? 1, 2, and 3. You're still feeling okay?
Yes, ma'am.
And so we have an electronic scale here. I'm going to help you on the scale, and then we're just going to put my arms around you once you're on the scale, just in case you lose your balance, okay? All right, let's go ahead and get you to step on. Thank you so much, Mr. Mitchell. Let's get you to step off, please. All right, so if I can get you, you can either step back, or you can turn towards the bed. Okay, great job. Do you need help getting your legs back in the bed?
No, ma'am.
Okay, all right. And here's your call bell, Mr. Mitchell. Is there anything else I can help you with?
No, thank you.
All right, I'll see you in a few moments, okay?
Thank you.
So now that we've finished the scale, I want you to pick up your scale. If your facility requires that you clean it off, by all means do so. But don't forget to document. That's right, but I want you all to document for me. In the United States, we document in pounds. However, if your facility requires that you document in kilograms, you'll do so by dividing the number of pounds by 2.2. So whatever the number of pounds were divided by 2.2, and that would give you the weight in kilograms. But you must document after you perform the weight. Don't forget to go wash your hands, open up that curtain, and then just to look back. Make sure that the bed's in the lowest position, that your patient or resident has their call bell. One last thing I want to add, in the state of Florida, if you're taking a CNA examination, the side rails are optional. So if the side rails are there, you're welcome to raise the rails. However, if they were lowered when you came in, you can also perform the skill and keep them lowered. The goal is for you to be able to provide care and to provide care safely. So you're not passed nor failed on the absence or presence of the side rails. You are judged on how you provide the care and whether you can do so safely. So I hope you learned a lot from this video. Remember, we have to do those weights. It helps to monitor the health of our patients. And I'll see you in the next video. Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com.